I'm Gillian McCabe, clinical specialist pelvic health physio over in South Wales, and today with me I have the fantastic Gillian McCabe, who is one of my clinical specialist pelvic health colleagues, a great mentor and friend. And today we're going to talk about the five facts that we tell all of our patients, the key things that you need to know when you've got some incontinence. So starting off with Gillian, what would you say to patients?
First thing is obviously get specialist help. If you've got any problems with your pelvic floor, with your bladder or your bowel, don't try and deal with it on your own. Don't listen to those adverts that say just whack a pad on, you'll be absolutely fine and you'll be a normal woman once again. Best thing to do is find your local pelvic health specialist physiotherapist. And that could be in the NHS, you can get a referral from a GP, or you can look, there'll be a couple of links from my website over to Jill's website, more Cardiff way, or you can just find someone that you know is trained in that area. So there's a couple of specialist sites, we'll put a link up on the end of this video. My tip would be to, when you've seen your lovely pelvic health physio, you do what they ask you to. So pelvic floor exercises, we know they work. We know that they get everything stronger, they work really well. But patients don't do it, and that's why they expect it to work like this. Yeah,
but we need to be cracking on, we need to be doing it regularly. So there are lots of little apps that you can get as well to help you.
There's the Squeezy app, which is I think an NHS app as far as I know. And you can download that onto your iPhone or Android, and it'll just remind you to do your exercises, and it'll give you a lowdown at the end of every week or the end of every month as to how good or naughty you've been. Yeah. But it really is a really good sort of motivation to keep doing those exercises when maybe you might forget. Yeah, so 3 times a day, every single day. Try and do it earlier on in the day, not so late in the day, and get them done. Don't forget them. Remind yourself, set a reminder, do something to get them done. Okay, number 3. Number 3 is don't let your bladder rule your life. So the main thing is quite a lot of women will think, oh, I better go just in case. But what you've really got to think is, do I really need to go? And a lot of women will be able to hold on a little bit longer than maybe you initially thought. And if you can hold on a little while, your bladder will forget about it, you'll get distracted, and you'll be able to hold a little bit more, which will allow that bladder to store a little bit more and help you out from avoiding any embarrassing situations. Yeah, it's those moments, isn't it, when you're just getting out of the house and you think, oh, I'll just go in case, just in case. But you're only going to the shops, so you know there's a really good toilet at the shops, or M&S is the best. Or you know that if you're going to a friend's house, you'll be able to go to the toilet there. So just don't do that just in case It can really get you into a bad habit where you end up not wanting to go out of the house, not going to certain places, not doing certain social events because you think, I'm not sure where the toilet is or how often I'll be able to go, and it really will start taking over your life, and you don't want that to happen. Nope.
Number 4 is constipation. Absolutely a no-no. So we know that when you get constipated, you're obviously spending a great deal more energy and a lot more pressure trying to push down to have that bowel motion. And that can really stretch the pelvic floor fibres. It can also increase all the pressures in the bladder and cause you to have more leakage. And that's not something that you're wanting when you're trying to get rid of it. So sort out the constipation. Drink more fluid. I know that's
the biggest one.
People don't drink, do they? They don't drink enough. So drinking more fluid.
Yeah. High fibre diet.
Fibre.
Yeah.
Get a little bit of exercise. Go for a walk every day.
And don't ignore your bowel. So if first thing in the morning you have your breakfast and you think, right, I'm going to shoot off to work, don't ignore your bowel. So if your bowel is saying, look, I could empty right now, don't hold off and think, oh, I'm not going to go, and then I won't go in work because I don't want to go in work toilets. And then by the time you get home, that urge may well have gone and it might not come back for a little while. So if you get the urge to go and you are constipated, listen to your bowel and go straight away.
Absolutely, don't ignore that bowel, okay?
Definitely.
And number 5, I'll give this one to Jill to finish up.
So number 5 is stick with whatever programme you have been given by your pelvic health specialist physiotherapist. Whether it's exercises, diet, lifestyle advice, whatever it might be, even if it's just trying to hold on that extra 5 minutes with your bladder, stick to it. You might not get results really quickly. With these pelvic floor muscles, they can take a good 4 to 6 weeks before they start noticing any changes and before your symptoms start to change. So you've got to keep motivated. Yeah, you've got to remember that those muscles are, if you're having some incontinence, they're probably pretty weak. You might not have done anything with them since you had kids, or they got a little bit weaker over time as we've not paid so much attention to exercise. So if you're starting with a really weak muscle that won't lift, it won't work, it's not going to overnight start pumping weights.
Yeah,
you don't walk out of the gym after one day with a six-pack,
No.
I'm afraid.
No. And if we're going to get a six-pack down below, which my patients all know that I try and aim for them to have a six-pack, you've got to work at it. So the evidence shows 3 to 5 months. That's what we want to be looking at. 3 to 5 months of exercises every day, at least 3 times, and doing anything else that your pelvic health specialist tells you to do. Okay? So that's been me and Jill and me, or the two Gillians, or the two Jills. Having a chat about our 5 key facts for patients that have any form of urinary incontinence or any leakage. If you want to check out any more information, go over to Jill's website, come back over to my website, the links will be underneath this video. It's been nice chatting to you. If you've got any comments, get in touch with us on Facebook or Twitter. We'd love to hear from you. We'll see you soon, guys.
See you. Bye.